Dear colleague, I want to present you this case that is a really interesting case, and then soon you can understand why. You are looking in this moment the head at the brain of this fetus. The woman was at our observation about 22 weeks of gestational age. She was 34 years old with no amniocentesis and no history for other problems. In this case, you are looking the brain, and the first thing that you see is enlarged ventricular. Uh, in this case, is not so enlarged, and then we can talk about a mild hydrocephaly or mild ventriculomegaly. The correct definition of is a mild enlargement of lateral ventriculus. The atrial width is around 20, 30 at 11 for atrium in the absence of the other sonographically demonstration anomalies of the brain. We know that the width of the atrium is normal around 10-11 millimeters. In this case is the first one, its left one is around 30 and the right one is around 11 millimeters. In this case, you know how is important to make an attention study of the brain, because isolated borderline ventriculomegaly should be differentiated from more complex abnormality of fetal brain that have frequently a different prognosis, like the genesis of the corpus callosum or spina bifida or other mass in the brain. The main problem in this case, when we found a borderline lateral ventriculars, is to exclude other neural and extraneural malformation. Then is recommended careful multiplan examination of the fetal brain, performed if is possible with a high resolution vaginal probe, and we need a good detail of the brain, but particularly when we found this situation, we have to check for the cavum of septum pellucidum and from the corpus callosum. In this condition, anyway, we are checking from all the brain associated malformation. Then we check for a good cerebellum, like in this case, from the insula, those are present, and we are looking for the cavoseptum pellucidum. In this case, you see it, but for to be sure, we have to check exactly the presence of corpus callosum. In this case, you see the atrium, you see the measurement is enlarged, but not so large. Then is a borderline lateral cerebral ventricular megaly, appear in this case isolated, but make attention. We are looking the frontal horn, those are enlarged, but there is no communication with the cavum septum pellucidum. In this case, you see the corpus callosum. Then you can think this is a normal situation, or the limit with the normal situation. Fetal borderline cerebral ventricular megaly in this case can have, can be without consequence. However, there is an increased risk of abnormal outcomes. Sometimes is a factors for chromosomal aberration. Then we have to ask the amniocentesis, we have to ask the fetal echocardiography, we have to ask the prenatal magnetic resonance to be sure that there is no other problem. Then we have to see after some weeks. Unfortunately, this girl came back at our observation after 10 weeks. And this is a new situation. There is not just borderline lateral cerebral ventricular megaly isolated, but like you can see in this case, there is the frontal lobe abnormals. You can see here, you can't see here the cavus septum pellucidum. In this case, we are in presence of the septo optic dysplasia. Is a different situation. It's not a simple borderline lateral cerebral ventriculomegaly. It's septo-optic dysplasia. You know, the septo-optical dysplasia is a syndrome characterized by anomalies of cerebral midline structures, such as the absence of the septum pellucidum. Look at here. In this case, it seems to be something like holoprosocephaly, but it's not so. In this case, there is connection between the frontal horn and the absence of the cavum of septum pellucidum. It's no simple situation, it's a dramatic situation. In this situation, there is a dysgenesis of corpus callosum that will be confirmed by prenatal magnetic resonance imaging. In this case, we have the probe that when we found an borderline lateral cerebral ventriculomegaly, we have to ask many questions. Why is so? In many cases, the isolated situation is at start and there is no problem for all the pregnancy. You just have to ask the amniocentesis, you just have to ask the RM, and you have to make attention in time with other ultrasound observation. But the risk is this: in a few weeks it will be changed in a dramatic situation, like in this case. And you can be sure that the first time that we saw these patients, there was impossible to make this diagnosis, like in this case. You see here the thalamus, the four regular ventriculus, the regular cerebellum. There is no enlarged more the lateral ventriculus. It's just the connection between the frontal horn and the cavum of septum pellucidum. Then we start with diagnosis of borderline lateral cerebral ventriculomegaly with the presence of corpus callosum, and we finish with this diagnosis of the septo-optic dysplasia. Thank you, dear colleague.